So, good evening, everyone. I hope I'm audible and visible. Everything's okay. Okay. So, today is again a very ultra short session as usual. So, every Monday and Friday we will be having a short session. And today's topic is very important because it is a small gray matter in your brain that is controlling all the unconscious activity in your body. All unconscious temperature regulation, endocrine regulation, sexual regulation, thirst, hunger, everything. Can you have any guess? Do you have any guess for that? Answer is hypothalamus. Okay. So hypothalamus is a small gray matter in your brain and that is controlling almost all the subconscious activity. Thalamus is for what? Conscious activity. Hypothalamus is for subconscious activity like temperature regulation, thirst, hunger, everything. So we will discuss one by one. First, we will discuss about the temperature regulation. So in temperature regulation, actually there are three nucleus which are involved. What you will get in your MBBS exam about the temperature regulation. They will give you a short note about temperature regulation. So who is going to sense the temperature? Answer is preoptic nucleus. Preoptic. So thermoreceptors are present in preoptic. But who will take action? Answer is anterior hypothalamic nucleus and posterior hypothalamic nucleus. So there are mainly three nucleus which are important for temperature regulation. Preoptic are having the thermoreceptor to sense the temperature, and anterior hypothalamic nucleus and posterior nucleus, they are working for cold or hot environment. For example, you are going to a cold environment. So if you are going on a cold environment, you start shivering. Right now I'm in Lucknow. Yes, hello dear. Good. So, so in Lucknow or in the north, right now we are having 8-degree temperature or 10-degree temperature. So why we are having shivering? So shivering and vasoconstriction, these are the adapting mechanism which are controlled by anterior posterior. Answer is posterior hypothalamic nucleus. Okay, so whenever you are in a cold environment, posterior hypothalamic nucleus will cause shivering as well as vasoconstriction. So remember, who will sense? Preoptic. And who will take action in the cold environment? Answer is posterior hypothalamic nucleus. But on the other hand, if month is June or July, the hot environment is there, we are having increase in the temperature. So which nucleus is going to work now? Then answer is, in that condition, answer is anterior hypothalamic nucleus. So remember A for AC, air condition. So when there is a hot, you want air condition. So which nucleus is involved? Anterior hypothalamic nucleus. So whenever they ask anything about temperature regulation, remember thermoreceptors are in the preoptic. And for hot weather, it is anterior hypothalamic nucleus. And for cold weather, it is posterior hypothalamic nucleus. The posterior is causing shivering and vasoconstriction. On the other hand, anterior will cause vasodilation and sweating. Vasodilation and sweating. So these, orchestration of these three hypothalamic nucleus is going to control your temperature. So this is clear. The first is your temperature regulation. Preoptic, anterior, and posterior hypothalamic nucleus. Now, what about your circadian rhythm? What about your biological clock? Which nucleus in the hypothalamus is acting like a biological clock? Remember, there is one nucleus above your optic chiasma. One nucleus is above your optic chiasma. So that is called as suprachiasmatic nucleus. I hope you will not forget. Suprachiasmatic nucleus. It is called as biological clock because whenever sunlight falls on your retina, it will go to optic chiasma, and above your optic chiasma there is a sensor. There is a sensor, sun sensing nucleus. Okay, suprachiasmatic nucleus. It will sense your sun. It is day or it is night, because when there's a day, the signal will be telling every cell of your body will know it is morning. How every cell of your body know it is morning or night? Suprachiasmatic nucleus. Is this clear? How beautifully your body is orientated to the, what is the time? For example, ACTH is maximum at 8:15. So how your body know time is 8:15 a.m.? suprachiasmatic nucleus. The nucleus below optic chiasma is called as suprachiasmatic nucleus. Is it clear? It is called as suprachiasmatic nucleus. This much is clear. Now, few things more. Do you know how hormones are regulated? How hormones are regulated? There is a one beautiful hormone, moon shaped. Okay, moon look like an arc. The name will be arcuate nucleus. Arcuate nucleus is controlling most of the hormonal function by hypothalamus. Is this clear? So, arcuate nucleus, very good, doctor, you are correct. Arcuate nucleus, very good. So, arcuate nucleus is the nucleus which release controlling hormone like gonadotropin releasing hormone, growth hormone releasing hormone, like that. The hormones from the hypothalamus which is controlling your body, especially anterior pituitary gland. Just tell me which nucleus is that? Arcuate nucleus. I hope you are not going to forget if you remember with the function. For temperature regulation, preoptic, anterior, posterior. For biological clock, suprachiasmatic nucleus. And for hormonal control, it's your, yes, please tell me. You can comment in your comment box also. Arcuate, arc shaped, moon shaped, arcuate nucleus. Is this much clear? Now, tell me about hunger and satiety. When you are taking food, okay, why you are taking food? Because you are hungry. So, which nucleus in your hypothalamus is telling you that you are hungry? And answer is lateral hypothalamic nucleus. Latte. Latte. Remember lateral by latte. Coffee latte. You want latte when we are hungry? Okay. So, hunger nucleus is lateral hypothalamic nucleus. Okay. Now, what about satiety? When you are having food, your lunch or dinner, okay, you will stop after a certain time because you are having satiety. So, which nucleus in the hypothalamus is telling you about the satiety? Ventromedial nucleus. It is ventromedial nucleus. So, ventromedial nucleus is telling you about satiety. So, only this much I will tell you in today's session. It is a concept building session. I can take 2 hour lecture only on hypothalamus, but my purpose here is that what is the minimum you must remember about hypothalamic nucleus. It is going to help you in anatomy as well as in physiology as well. Yes, you are correct, doctor. Arcuate nucleus, very good. Okay, so tell me about, just revise with me, temperature regulation, preoptic, the sensor. Okay, then air condition, anterior, who is acting like a heater? Who is acting like a heater? It is your posterior hypothalamic nucleus. It is your posterior, there is some fluctuation, posterior hypothalamic nucleus. Okay, so this is it for today's. I will not exceed more than 7 to 10 minutes. We'll catch you this Friday again with certain diagram. So every Monday and Friday, I will be taking small session, but that will be very fruitful. Purpose is not to bore you and to just, there should be intrigue in yourself about the physiology. Okay. So all the very best. Thank you.